This is a podcast by Lumina, the perfect space to innovate, collaborate, and grow in health, science, and tech.
Noam Dishon, welcome to Health Tech Talks.
Hi, Rebecca. Thanks for having us here today.
It's an absolute pleasure to be talking with you today, Noam, as the first of our three-part series on business and client relationship automation. Let's start with Wellifiy. Can you explain what it is and how this idea came about?
So at Wellifiy, we help healthcare providers create more meaningful and personalised healthcare experiences with their patients. That's at a high level. To sort of break it down a little bit further, I mean, the background to this was I'm a clinical psychologist by background, and I still work in clinic a little bit every week. Several years back, I was working in a few different settings. I was working in public healthcare and private practice as well. Kind of noticed the odd reality occurring that we would often discharge patients from an admission with very little support, really. It could just be like a business card with, the site triage number on the back of it. And people would often come back to the hospital, or actually sometimes tragically, much worse. So that was a huge problem. At the same time, I was working in private practice, and I still recall one afternoon I'd ordered my lunch to the clinic, and I remember thinking that I've got better information on the status of my Domino's pizza than the client that I'm about to see that I'd not seen in the last 2 weeks. And I just thought that was ridiculous. So that's kind of where the idea of Wellifiy was born, I guess. And so, what we've done is we've built a two-sided platform. So there's a patient-facing mobile app and then an interconnected clinician-facing portal. And they basically work in tandem with one another to provide patients with 24/7 access to tools and resources, content that's been curated specifically for them by their care team, and then to provide the care team with much better insight into the way that people are tracking between appointments or even post-discharge. So, that's kind of the platform in a nutshell. There's a few other bits and pieces to it, but I'm sure they'll come out over the course of this chat.
So you had this idea while ordering your lunch, and then you've created this incredible platform. But how did you do it? You're a psychologist. You're not a web developer or an app developer. How did you go about that process to bring it to life?
Yeah, definitely was a process. I've learned a lot of stuff between having the idea and where things are at today. So I basically started doing some wireframes. So this is where sort of started sketching out what the platform would sort of look like. And then from there, I taught myself how to develop like a prototype. So this is kind of going a little bit beyond the wireframes to actually, creating like a user interface essentially, and then connecting that into itself so you could click through the platform a little bit. And then with that in my pocket, I guess, I was able to sort of go to a few different angel investors, and I managed to get a little bit of funding to start to kind of get some developers and actually build out the back end of the platform. That was kind of how it started. And then from there, we managed to sort of acquire some customers, and we've basically been bootstrapping since then. And we've grown our team and grown our customer base. But that's basically the origin of it.
Yeah, what a learning curve, I imagine. Did you have any issues developing the app? And if so, can you shed any light for others looking into creating an app?
So I guess probably one of the early challenges was when it came to actually the development of the app. So after I created the prototype and raised a little bit of money to get the app built, I initially engaged with a software development agency. It sort of served its purpose at the time, I guess, to get an MVP up. But then I realized early on that it really wasn't going to be a long-term viable solution. So from there, I got my own developers. Also, my co-founder, Paul, came on board, and he's our CTO. So Paul, he's had a tremendous background in a whole number of really large startups. And so, him coming on board and I guess building out our internal development team was a huge development solution.
So what was the time frame between you having this idea and then launching?
It's probably about a year between the idea and getting the MVP up and running. But the distance between the MVP and where the platform is today, is probably orders of magnitude, greater than the distance from the idea to the MVP, if that kind of makes sense, right?
And what about testing of the product?
There's a whole process that we've got around that, because obviously, working in healthcare, the reliability of the platform is one of the most paramount things, alongside obviously, privacy and security and confidentiality and all those, sort of core elements. But reliability is, central. So we've got a very rigorous testing process methodology that we employ, internally before anything ever sort of ships to production.
How did you test from a client-patient perspective that it would work for them and that it had what they needed?
There's a few different pieces to that. So one of them is that, because I still work clinically, for the clients that utilization of this platform, has a sort of clinical utility for, I can introduce it to them. and I'm able to sort of get direct feedback and keep iterating it and improving the platform based upon that direct feedback. The other thing is that we work very closely with our customer organizations, again, to talk to them regularly, to get feedback, to kind of distill the learnings that come from that and, keep iterating and improving the platform in a very agile and feedback-informed manner.
So, Noam, let's pivot to the topic of mental health. Thankfully, it's no longer a taboo topic, and rather it's becoming an important conversation to have with others. Are you seeing any trends or common denominators in mental health and how Wellifiy can help?
Yeah, look, I think probably over the last 5 to 10 years, there's probably been a growing interest in starting to track, patient outcomes. So I think that's significant. This is the idea of giving people, kind of self-report questionnaires before they commence, a service engagement, and then during and after to actually be able to get some sort of data on progress over the course of that treatment. So that's definitely something that has increased over the last 5 to 10 years and hopefully, will continue to. I'd probably say that as the biggest thing, but then, obviously now there's other things. So we're supporting services to deliver sort of blended care model of delivery where they can, in addition to providing the sort of face-to-face or telehealth service that they're providing, they can also support clients in between sessions with things like different activities or access to different tools and resources.
Can you take us step by step through how the app streamlines patient communication and education, set and achieve goals, coordinate care plans, and track process?
Kind of three main pillars to our platform and the functionality that we offer. So, they really kind of are situated around this idea of sort of communication, education, and tracking. And so in terms of the communication part of it, we can support different modalities of that from, sort of text-based, in-app messaging to video calls as well. In the context of the education part of it, there's a whole capability of the platform to allow the care team to provide to the patients, different educational resources and content. It could be PDF, audio, kind of video-based formats. And then in terms of progress tracking part of it, this kind of links in with what we were just touching on before about the outcome monitoring, but this is where, care teams can send patients different types of assessments and questionnaires that are then repeated on a recurring basis, potentially to track that progress over time. Pulling all those things together, then there's the ability to sort of help get a kind of care plan, develop, goals collaboratively with the care team and cultivate a care plan that everyone, including the patient, is a participant in.
You're listening to Health Tech Talks, a podcast series delivered by Lumina. To find out more about Lumina, visit the website luminagoldcoast.com.au and sign up today to receive your Lumina Opportunities Pack.
So if I'm a patient and my psychologist uses the app, what it means in practical terms is that I can log on to the app as a patient and look at my care plan and connect with my psychologist in between appointments. Is that it in a nutshell?
Yeah. So you could do those things. You could access different mindfulness tools that the psychologist is activated for video-based kind of resources.
Putting myself in the shoes of a business owner, there is never enough time in the day and there is always so many hats to wear, from accounting to following up on clients. How is AI used in this platform to assist?
All those different things that we've been talking about in terms of the assessments, the content. So that can be configured on a per patient basis, depending on their particular needs. And, we can use, workflow automation to basically set that up so that the clinician doesn't have to sort of manually kind of activate all these things or deactivate things on an individual patient basis. We can use sort of, workflow automation capability to, in one click that will sort of sort it all out for that particular patient, basically.
I understand you use AI-infused innovation. Can you explain more about what that is?
In addition to the workflow automation part of it, there's also some stuff that we're doing in terms of the data collection part of it. So as you know, things like mobility and sleep are really significant pieces of data for healthcare providers to be having some awareness and insight into, in terms of being able to help catch red flags on declining patients' wellbeing. We are able to ingest that data and then, using AI and machine learning, then run different analysis on it to generate predictions on changes in clients' wellbeing, basically.
How does Wellifiy increase patient engagement, and are you seeing an increase in patient results?
There's a few different ways that we kind of support this. So to take one example, if you go to see a psychologist, often what happens is they will give you worksheets to take home and look at and complete in between meetings, right? Now, the thing is that we know that when people do this, it can actually be tremendously helpful in terms of treatment recovery. The challenge has often been for a long time that the experience for clients is very poor, right? Because what that means is that you then need to be lugging around pen and all these sheets of paper with you. Once that's filled out, then you bring it back to the therapist, and then they need to review all these different materials and sort of make sense of it. So that's a bit cumbersome on both ends. With our platform, the psychologist can just activate like a digital version of some of these different tools. The client can do them in the app in a sort of more private and discreet way whenever they would like. There's no sort of paper to lug around or have left around and be sort of vulnerable. And then the clinician can see that on their side of the platform, immediately and review that at the start of a meeting with them or something like that. So that's sort of one way that we can increase engagement as an example. And as far as improving outcomes, talked about before about how we can send out questionnaires to people over the course of their treatment. And so we see the data from that, seeing people when they start an engagement to when they complete an engagement, improving.
How does the app identify early warning signs of mental health decline?
So there's a couple of different ways that we support that. I mean, one is connected to like that outcome monitoring piece that we chat a little bit about. So if the patient is doing a questionnaire on a sort of fortnightly basis, and then the health service starts to see a decline on that. That's one pathway. The other is, through some of this, the collection of the passive data, so like things like step count. And so if people are, typically walking 8,000 steps a day, and that, kind of reduces down to 2,000 or 3,000 steps, that can often be a pretty significant indicator of a change in mental state and well-being. There's other check-in type of capabilities that the platform has got that can be more patient-driven. But yeah, there's several ways.
So Noam, what is a white label mental health platform, and what's the benefit to other businesses in health tech?
Yeah, so white label platform basically just means that we take our logo and colour palette and branding off, and then we can apply the healthcare services logo and colour palette and branding. And yeah, we think that's important for healthcare providers to be able to offer for that type of solution to their patients.
Yeah, fantastic. Now, Wellifiy, what is your goal with your fantastic product?
I mean, our goal is to help health services improve the digital experience that their patients navigate through, and to also drive better outcomes for patients at the same time in terms of their health. And then I guess alongside that is also to improve the lives of clinicians who are operating these services and reduce the burden of some of the tasks that could chew up time and take them away from doing the clinical work that they're actually interested in doing.
What sort of feedback are you getting from clinicians?
Yeah, feedback's it's great. I mean, we love to talk with the clinician users as well a lot, and feedback is generally really positive around the way that we've been able to streamline different processes that would otherwise be taking them like a long time to kind of manually do. And also, a lot of positivity around seeing the sort of engagement from their patients and the improved outcomes as a result.
And what about patients? What are they saying?
Yeah, similarly, it's, I guess kind of the other side of that, right? So patients, they're typically reporting having a much more seamless experience with their healthcare provider, that they can sort of do everything in the one spot in a centralized kind of way. It just really optimizes their patient experience.
Even something as simple as when is my next appointment, is that on the app?
Yeah, absolutely. Yeah, that's all in there, yeah.
As part of this incredible journey that you've been on to create Wellifiy, you were a participant in the Lumina X Health Tech Accelerator program. How did the program influence your journey?
Yeah, Lumina X was awesome. It was a really fantastic experience, and I would highly recommend it to anyone else that has a thought about doing it. Yeah, just go ahead and definitely apply. It was really beneficial for us. We learned a whole lot of things, from, data marketing and sales and, financial modeling. The whole spectrum of really valuable business development type of topics and content were covered. The mentoring was amazing. So just a lot of insights that we were able to draw through all of those workshops and consultations. And then also, the regular coaching with your coach was tremendously valuable and really helped with shaping, different sort of goals that we wanted to kind of hit over a period of time and really help keep us accountable. We definitely grew a lot through that experience.
Also, the people that you meet through these programs is exceptional.
Yeah, absolutely. Yeah. I mean, I guess I was sort of relatively isolated in terms of engagement with other people in tech or the startup space. So that was, probably on par as being one of the most valuable things about the program, was actually just being able to be in a bit of a community of other people doing something similar and sort of break that sense of isolation there. And also, I guess, I'm from Melbourne, so going up to Queensland every couple of weeks was absolutely unreal, and I love that.
Big bonus of the program. Well, Noam, it was fabulous to have you here in Queensland for the Accelerator. Come back anytime. And congratulations on your amazing creation of Wellifiy, and thank you so much for talking with us today.
Thanks, Rebecca. It was a pleasure.
You're very welcome, Noam, and I hope that everybody can rejoin us for our next episode of our 3-part series on business and client relationship automation, when we'll be talking with Dr. Padma Gadia from Smilo about how AI can benefit your business.
To learn more about Lumina and how we work with health tech startups, visit luminagoldcoast.com.au. And don't forget to sign up to receive your Lumina Opportunities Pack today.